So I just want to say before we carry on with some patient stories, I just want to say a massive thank you to everyone who's gotten involved with the United Patients Alliance over the years. It's a massive struggle to become an activist, to fight such an unjust law, and to try and push this forward against the Conservative government in the political climate that we have in the UK with Brexit going on and everything else. It's a lot, and everyone who's gotten involved, I just want to say a massive thank you, because it's you guys. It's not just the people who are standing up in front of you today, it's people all across the country who I know will be watching on Facebook Lives, and you guys in the audience as well. So thank you to all of you. Without further ado, we're going to carry on with some patient stories, and I am up next. So my name's Alex Fraser, I'm 27 years old, I live in Brighton, and I have Crohn's disease. I was diagnosed when I was 19 years old. So the main symptoms of Crohn's disease: diarrhea, vomiting, nausea, pain, inability to sleep, loss of appetite, which then induces weight loss, and then of course the mental side effects as well, anxiety and depression and PTSD-like symptoms as well. And cannabis helps pretty much every single one of those. It meant that I didn't become dependent on opiates, which actually have incredibly negative side effects for digestive diseases. It's meant that I'm able to control my nausea. For a Crohn's patient, I pretty much never vomit. I have never vomited. I think when I started being ill, before I was using cannabis, I was throwing up 10 times a day. When I used cannabis, I didn't throw up at all, which is a massive benefit when you're spending a lot of time in a bathroom anyway, to not be throwing it up, which is a lot more visceral and extreme, then that makes a massive difference. And that ability to sleep is also massively important. And we talked about appetite stimulation a minute ago, and all the munchies, as it's often known. So everyone checking? It's not there yet. Do keep an eye on it though. So yeah, the munchies, and we call it the munchies, but it is appetite stimulation, and that has been absolutely crucial to me. And to be standing up here in front of you, I would be half the man I was, quite literally, if I hadn't had cannabis there to make sure that I ate full 3 meals a day, to make sure I had the appetite to do that, which when you're vomiting and you're shitting 20 times a day, excreting 20 times a day. It makes a massive difference. And of course to the mental health things as well. I do think there are points with this disease where you go to some really dark places, and thankfully cannabis was there as well to lift me out of those dark places. So, I mean, I really owe my life to cannabis. It's absolutely saved me. There are 3 things that I want to talk about sort of beyond Crohn's. I want to talk about when we're legislating cannabis in the UK. There are 3 things that personally, and I think a lot of patients are very afraid of. One of them has been touched on a little bit already, which is a limited list of conditions that cannabis might be available for, which is obviously completely ridiculous. We need doctors to be able to... No, okay. We need doctors to be able to prescribe for symptoms. We need doctors to be able to prescribe to people they think will benefit before they've been diagnosed. It took me 4 months to get a diagnosis. And some people with certain conditions never get a diagnosis, but they have pain, and they have migraines, and they have things that need treatment. These people are prescribed painkillers, they're prescribed steroids, they're prescribed anti-inflammatories, they need to be prescribed cannabis as well. The second thing is something that's been implemented in other places like Australia, which is essentially where they say you can try cannabis, you can have cannabis on prescription if you've already tried the traditional therapies for your particular symptom or your condition. Again, this is ridiculous. The idea that people would have to put themselves on opiates, powerful anti-inflammatories, immunosuppressants, before they've tried a herbal, non-toxic medication is absurd. And we absolutely should be allowing people to... I'm not criticising those medications, and they have their place, and there will be people who need to be put immediately on steroids. I immediately needed to be put on steroids when my symptoms first arose. But if I'd been put on cannabis at the same time, I'd have needed a lot less steroids to control my condition, and my dependence on them would have been a lot reduced as well. The third thing that I'm really worried about is the continued criminalisation of people consuming cannabis. And we think there's about 1/3 of people who consume cannabis for medical reasons, and that number's only going to rise. Recreational is great, and that's something that we wholeheartedly support, but the criminalisation of patients when they're going out and living their lives is just not acceptable. We cannot have patients having to carry around a card that proves their legitimacy to consume their medicine when they're on their way to work. We cannot have patients being stopped by the police to continue to live their lives as free individuals. We must decriminalise cannabis across the board to make sure that patients are not bothered by the law and are not caught up in this system. If I'm a medical patient and I have a medical marijuana card and I go out, I forget it at home, I have memory issues because of the medication that I'm on, because of the illness that I have, and the symptoms. If I forget my card and I'm arrested and I'm put in jail overnight, my symptoms will get worse. I could be in a terrible situation. I can't imagine what that would be like for someone with a neurological condition like Clark. We just cannot be put in that situation as seriously chronically ill people. So a decriminalisation is an absolute must from my perspective. It sounds like you support that idea. That is pretty much me. I now have the pleasure to introduce some more patients for you to hear testimony from. Next up, I would like to introduce Tasha Dean.